the question that was written to me is, how cost effective is DBS, and where can we get it locally? So on the first question, it is not cost effective, so it is expensive, considering when I was in Brown University or affiliated hospitals, DBS used to be done as a procedure there, and it needs a multidisciplinary approach, which includes either a neurologist or a psychiatrist, as well as a neurosurgeon. And it is a neurosurgical procedure whereby they have to insert those electrodes to your brain. And also the equipment itself is expensive to buy. So the cost usually went in excess of $10,000, which is in excess of 1.3 million shillings, Kenya shillings. So I don't think it is cost effective. So on whether it is available locally, I can't say for sure that it is not available locally, but I doubt if it is available. Because after all, some of the hospitals that are coming that are innovative, like Chiromo group hospitals, it could be innovative enough to have it. So I'm not sure about it. Maybe the people in this hospital can tell us. But recently, I saw SHA was offering sponsorship of treatment to countries abroad for procedures that are not available locally. But I did not see this procedure being listed there. So I think that is one thing that SHA can take up and sponsor people to be treated abroad for procedure as one of the procedures that is not available locally. So another thing is that it needs development in terms of expertise. As I've told you that a surgical procedure has to be done, so there has to be somebody to do the procedure. Also, equipments are needed, like the PET scans and the fMRI scans, and the people will interpret it and suggest which areas of the brain to be targeted. So you also need capacity development and equipment development also. And finally, I would say that the lowest hanging fruit among these treatment options is the VNS option. Number one, because it is older, so meaning there has been a lot of time to improve it and also to make it cheaper. And then number two, there is an non-invasive form of it that targets a sensory area in the ear, as I described during my presentation. So that is one of the neurostimulation stimulations that can be easily available locally to assist ECT, because ECT is doing the heavy weight lifting in our country. Thank you.
Thank you very much for organizing this second symposium. And I do appreciate also the speakers who have been able to share with us the work they are doing, the work that is challenging the narrative that we're doing. When I was sitting there and Dr. Simon was talking about dementia, and then there was Dr. Katwa talking about the future, and that now we may need to put away ECT. I was like, I just launched the National Clinical Guidelines 2 years ago now. This dude want me to go and start reviewing them. I know in my head I'm thinking, yeah, it's good progress, but now we also need to keep updating the policy documents that we have in place. And we accept that challenge, because we are here as policymakers to guide and ensure that we give the best evidence-based interventions for our Kenyans.